Okay, so that is now recording. So thanks everyone for coming along to the Toolkit launch for Making Positive Moves. My name's Silvana Mengoni. I'm based at the University of Hertfordshire and I'm one of the members of the Making Positive Moves research team. Colleagues will be talking throughout the session and they'll introduce themselves when we get to them. But it's so fab to have over 100 people here. So thank you for joining us. We're really, really excited to tell you all about our toolkit today. So without further ado, we will crack on. Trying that. Okay. So today we'll just do a very short welcome. We're going to tell you how Making Positive Moves, the research project, started and kind of our journey to how we got here and the evidence behind the toolkit. So we'll tell you about what our research found, how we developed the toolkit. We'll introduce our toolkit and we'll give you an idea about what it looks like and how you might use that in practice, and also how we're going about testing it in practice as well. And then we'll have time for questions at the end. So you can write your questions in the chat between the research team. We will be looking at those. We'll answer them as we go along if we can, or we'll save them all at the end. For example, if we get lots of questions about a similar topic. You can also write in the Q&A stream if you prefer that. We know the chat can get a little busy and can be quite difficult to kind of monitor and keep an eye on. So if you prefer to use the Q&A, do. You can also at the end just put your hand up or unmute yourself and ask us some questions that way. Okay. So we'll, when we come to the end, we'll have a summary of all the comments and all the questions, and that's when we'll stop the recording. Okay, as I said, we'll be putting the event on our YouTube channel, and we'll also be sharing the slides and the recording directly with everyone that registered. So we'll be sharing the links today, obviously to our YouTube channel that's there, but also to our website, to our animation video, to the toolkit. Don't worry about making a note of all of those. We will be sharing the slides with you after today. So I am going now to pass on to Annabelle, who's going to tell us about how Making Positive Moves began. Can I?
Hiya.
Oh, there you are. Oh, you were on my other screen. You're on my second screen, Annabelle. There you go. Okay, fantastic. Thanks, Annabelle. I've got control of the slides, so just let me know when you want me to move on.
Thanks, Silvana. Hi, so I'm Annabelle. I'm a clinical psychologist now working in Derbyshire, although I was based in South London when we were doing the project. And I was lucky enough to be the research fellow on the research project. But we'll start by talking a little bit about Joan, who's this lady here in the white in the middle of the picture. And you can see the lady to her left. On the right of the screen next to her is Louisa, who you'll be hearing from in a minute, the lady with the lanyard in that picture. So Louisa met Joan many years ago now, and Louisa met Joan when she was moving out of hospital. So Joan lived in hospitals for 37 years, which is really an unbelievable number of years. Some of that in and out, some of it, there was an 18-year block in the middle of that where she was in hospital. But she was able to move into her own home as part of Transforming Care. So I'm sure most people here are aware of Transforming Care, but just to explain that there was the NHS England government scheme to move people out of inappropriate hospital placements after abuse was found as part of Winterbourne View. And this photo was taken when Jane had moved into her own home, and she lives there now in a little house with a garden and her own team, and she was able to make that move as part of the Transforming Care agenda. And Louisa understandably found this whole story incredibly difficult and incredibly sad, but also incredibly inspiring, that Joan was able to make that move and make a success of her life. And Joan and Louisa inspired me as a trainee clinical psychologist to do my research project into what it was like to move out of hospital. So I interviewed people with learning disabilities about what it was like to move as part of the Transforming Care agenda out of hospital placements into the community. And then the research team, so Louisa, me, Helen, we got other people involved like Sam and Silvana, who you'll hear from, were inspired even more to think about, okay, so that move has happened, but what happens then? Someone's in their own home, how do they make it a success? And that's where Making Positive Moves, the big research project, has come from. Talking to people with learning disabilities themselves about what it is that has made their move and their life in the communities a success after that move. What has helped, what has got in the way. And it's a research project that's a unique project that has spoken to people with learning disabilities themselves and really focused on their voices in terms of understanding that how they make a success of it. So we applied for and were very pleased and excited to get the funding for the research project. So you'll see here some of the names of some of the research team. We tried to start in COVID, didn't we? And it all got a bit delayed, as most things were at that time. So we started in late 2020, and we had a large qualitative research study funded by NHR and recruiting from some of these sites that you can see there. So Hertfordshire, Essex, London, Warwick, talking to people who had moved out of mental health hospitals, assessment and treatment units, prison, forensic services, and moved into their own homes in the community. One of the great things about the project was that it's a longitudinal project. So we interviewed the same people twice, at least a year apart, to see what had changed, had things improved for them, had things gone wrong. If they'd gone wrong, what had got in the way of making that move a success. We had a huge amount of data, as you can imagine, lots and lots of interviews with people. And we used a research method called grounded theory to develop a model for what it is that helps people to stay in their home after their move. There's loads more information about the research findings that is going to be published, and some of it's on our website already, but we were also really lucky to be able to make a video which focuses on most of the results of our study. So we're going to watch that now. Some people may have seen this already, but it's always worth a rewatch because it's a very powerful video, but some of it will be new to you. This one is also available on our YouTube channel if you want to rewatch it or share it anywhere. And you'll hear our narration for this video was done by Joan. So she's been central to the project really throughout. So I'll hand it over to Joan in the video to share more of the findings.
My name is Joan. This is our research about how people with learning disabilities can move out of hospital and live their best life in their own home. Based on interviews with 24 people with learning disabilities, including me, we identified 4 key supports that are needed to form a strong foundation in order for people to live their best life. These 4 supports are my strong foundation, and we created a model that describes how these supports work both individually and together. These supports are feeling safe in my relationships, making my own choices, belonging and keeping busy, and feeling happy with who I am. Feeling safe in my relationships. Feeling safe is the most important thing. I know my staff team really well and they listen to me. I trust them and I feel safe to talk about how I feel, which really helps. Some people didn't feel listened to, and this really damaged their foundation. Making my own choices. All of us want to make our own decisions. Not getting to choose can be very frustrating. It is a big step and gives us our freedom, but we also understand that sometimes we need help to make good decisions. We trust in our support team. we can make choices that help us live our best lives. Belonging and keeping busy. For me, belonging is an important part of my foundation. I really enjoy being part of the community and chatting with neighbours. They are all very nice. I am lucky. I found it important to have a routine, go outside and take part in activities too. And many of us would like a job. Feeling happy with who I am. The final part of my foundation was feeling happy with who I am. For most of us, hospital gave us a bad story about ourselves. But now that we are doing so much more and with the right people around us, we all feel so much happier about ourselves and proud of how far we have come. In summary, the overall finding are that people with learning disability who have moved out of hospital need these strong foundations they build with their support team. However, if these needs are not met, our foundation can crash and we can't live our life. All of our foundations are built differently, but we all need them to live our lives well. And when one of them is strong, these others get stronger too. I work really hard with my staff and other important people in my life to create my foundation and keep them strong. I feel really proud of everything I have done and how far I have come. And it feels brilliant to have my freedom.
For more information, please visit our website www.makingpositivemoves.org or email the research team using the address hello@makingpositivemoves.
I will leave the end of that video there, but I hope you enjoyed watching that. I, for one, never get tired of watching and listening to that video and the wonderful narration from Joan. I'm going to hand over now, I believe, to Helen and Sam to talk about the co-production workshops. And I'll control the slides and just let me know when you want me to move on.
Thank you, Silvana. I'm afraid I didn't introduce myself at the beginning. I'm Helen Ellis-Caird, and I'm a psychologist and part of the Making Positive Moves team, and I was just a little bit late, so sorry about that. Sam, I don't know about you, but
yes.
There's just something lovely about seeing all those hearts and all the kind of claps. I don't know how you do that. I need to figure out. I'm still not very good at using the teams, but that was lovely to see that.
Well, so I need to introduce myself as well, Helen.
Oh, you do? Okay, please.
We were just introducing as we went, otherwise it would spend a lot of time, so don't worry. So, hi everyone. My name is Sam Prowse. I'm an expert by experience, working Hertfordshire County Council in the Adult Disability Service. But for the research, I was the chair of our group of experts by experience, who played a major part in all of the work we did. And everything we did is all about listening, and it should be about listening and acting together. So we've got a lovely picture here to start off with, haven't we, really, which is one of the hottest days at the university. It was awfully hot. You escaped it because you were at home, Helen, so we can see your picture in the background there.
My huge picture.
But it was really important having that, because we were able to have some of the participants that have been part of the research come back and find out about the findings, and actually just almost using it as a real sound blog, checking that actually, does this make sense in what we've said, what we've heard from you, and to go forward.
Yeah, absolutely. We had our workshops had many attendees who were kind of formed different parts of our kind of stakeholder groups, really, didn't it? From participants, people that hadn't participated in our research but who themselves were in the process of moving out of hospital, as well as kind of family members and carers and social workers and nurses. We really had it was fantastic getting, I wasn't actually in the room for that one, but it was fantastic getting everybody together, and really it was a chance to think, how do we use this research project and these kind of really powerful findings to help people to live their best life in their own homes. That was kind of where we were heading, wasn't it, Sam?
It certainly was, but we had the rich detail of people that were in the room that were with support staff in the middle of transitioning out of hospital, and actually they managed to open up to their staff about a little detail that made such a hopefully big difference going forward, and actually strengthening their foundations together when we think about the model, and that really important. So I think it was so lovely to see work live in action, if that makes sense.
Yeah. Should we move to the next slide? Because we had 3 of these in total, and I guess we had a number of questions that we were asking people to sort of advise us on and think together about what would be best. And the first really was, if we make a resource from this research, what is it going to look like? And we did think about various things, but I think what we came back to was always the model. The model, that those 4 foundations was the thing that people related to. And so we decided that actually that would form the basis of whatever tool we produced. And then we were kind of thinking, well, what do we want that to do? What do we want it to do? And people had ideas about 3 areas. Having a tool that could help people to sort of check out their foundations, to kind of have a bit of a sense of, how are they doing? Are they feeling strong? Do they feel like they give me the foundation I need? Or, are there any cracks? But I guess we wanted to sort of go beyond that, and that was the feedback in these workshops, was we don't just want to know how they are, we want to give people ideas about how they can strengthen their foundations and repair any difficulties that were kind of coming up. And the model, as I'm sure you'll hear from kind of Joan's commentary on the animation, it's all about the interrelationship between people. It's how we all work with other people in our lives to strengthen our lives. So it was really important for this tool, or this kind of set of tools, to be something that people could use in conjunction with the people who supported them.
I think really important as well that people understood that foundations in life, one size doesn't fit all. We all know this, but we know that things aren't always going to be perfect, and that's absolutely fine. But actually making sure that people understand the support that they have around them, and those bits that can strengthen things. And we can't all be super strong all of the time, and it's okay not to be strong. And that reassurance that we can work together and work with your support networks around you to make sure that you stay as stable as you can. And in the research where it hadn't gone as well, where people had gone back into hospitals, etc. And that's so, we don't want people to be in there, but actually, if someone does go back into hospital, we want people to be in there for as minimal amount of time as possible, and working out and actually thinking that with these foundations, what actually could have worked better, and is there anything we can do in the future to try and prevent something? So it's a constant learning cycle.
Yeah, exactly. And that's where actually those workshops helped us to understand that we could use this tool, this foundations tool, at each point in somebody's journey, from kind of planning discharge through that transition, and then kind of as a touching point, as you say, when people are living in their own homes in the community, and also as part of other kinds of conversations that we have, like care plans or PBS plans and safety plans. We felt that people felt that it could be useful at each one of those junctions, and at each one, as you say, Sam, it's just thinking, well, where are my foundations at now? Because foundations aren't static, are they? They change and evolve over time, and that it would be for that person and that person's support network to kind of to do together. I guess the other thing that came out really strongly was, how do you actually use these in practice? And one of the things people thought was a really good idea was to develop some how-to guides about kind of, or how do you actually use this resource? And what do we think about the kind of wider system that allows this toolkit to either be, really effective for people, but what are also the kind of barriers to that? So, I think we had some very in-depth discussions, and I think it helped us to get to a genuinely co-produced toolkit, which I think we're all really proud of. Would you say, Sam? Oh, I think Sam's frozen. Yeah, sadly, Sam's frozen. Sam, I am taking that your lack of response is not because you're not proud of this, because I know you are. But let's move on to the next slide, and I will be handing over. Thank you.
Thanks, Helen. So hi, everyone. I'm Louisa Rhodes. I'm also a clinical psychologist. There's been a few this afternoon. I work in the West Hertfordshire Specialist Learning Disability Service. But in relation to making positive moves, I was the chief investigator for the research study, which is just kind of a fancy way of saying...
Sorry, can you hear me?
Oh, Sam, we've got you back. Are you there? No, he's gone again. Oh, Sam, he's having signal difficulties. Yeah, which kind of means I had a bit of a job in everything in the research, but kind of overseeing the research study. And particularly, I suppose, the main jobs that I've done is around creating a network. So reaching out to people who might be interested in the study, trying to build links with organisations and kind of pathways, I guess, like policy streams and things like that, to just think about where do we need to take the findings from making positive moves and how do we get them out there as much as possible. So now the research is over, I spend a lot of time talking about it in different places, and trying to find ways to get our model used, really. Joan, Wayne, Christine, we've got a number of people who've really helped us, and they've kind of produced videos. So they were participants in our research, but also produced videos telling their stories. And all of them told us that the reason they did it was because they want to help other people that are having hospital experience. And so, we keep that as really central within our Making Positive Moves team, and it's one of the things that kind of pushes us on to keep doing the work and trying to get it into practice. So we're so grateful to have so many of you here to learn about the toolkit and to hopefully be able to use it. So I'm going to tell you a bit about how the toolkit works now. I'm going to mention before I start that we worked with an incredible team that produced our animation, and they're called Beluga Animation. They're a really small team, 2 guys, Max and Jonathan, but they seem to get our project and totally understand kind of what we were aiming to do. And they not only did our animation, but they also produced this booklet for us. So they've done all the design and pulling together the resource. We, obviously kind of created the content and have co-produced that in our workshops and then since, but I just wanted to mention them because they've done an exceptional job. So we're really grateful to them for all the hard work. So in terms of the toolkit, I'm just going to show you kind of a brief introduction to it and how it works. So within the toolkit itself, it has some guidance at the beginning as the introduction part, which describes sort of who it's intended for, how it was developed, which we've already spoken about. And then it basically is based around the model. So there are 5 sections which are in line with the foundation. So we've got a feeling safe section. We've got foundation 2, making my own choices. Foundation 3, belonging and keeping busy. Foundation 4, happy with who I am. And finally, a section on living my best life. And so then when you go into the toolkit, there is some more guidance about how to use it. And hot off the press, we have now a how-to guide. We promised our co-production team that we would produce one, and we have done. It's on YouTube on our Making Positive Moves channel, and you can get to it from our website, which has also gone live in the last 24 hours with changes. So the toolkit is now fully available from there. The how-to guide really helps you to think in a bit more depth about the process of doing the toolkit in practice. And that's some of the things that might be the amount of time that you spend doing it, the fact that you can start in a different place, so you don't have to start with feeling safe. You can choose a foundation to begin with. It talks about different ways that you might adapt the toolkit in terms of communication, depending on a person's needs. So there's lots of things on that how-to guide. So I'd really stress that if you are going to do it, the how-to guide is about 20 minutes long. So please do go and watch that. But just to give you some insight into what the toolkit looks like, so for each foundation, we follow exactly the same structure. So I'm going to show you foundation 1, keep feeling safe in my relationships, but this same structure applies to all of the others. So with each foundation, you get an introduction to the foundation, which talks about what our research told us. So that kind of centres the key things. So for feeling safe, our participants told us that they needed to feel known and understood by the people supporting them. They needed to feel listened to, and they needed to feel a sense of connection and belonging. So our aim in putting that there is to really help people connect with the ideas that underpin that foundation. And then when you go on to the next page of the foundation, we use the same layout throughout the toolkit. So there are some key questions that are directly from our research. You get the questions on one page, and you get space to write opposite it so that you can always be filling in the booklet as you go. There are 2 versions. So there's a print version where you can print it off and fill it in. There's also a digital version, so you can type into the boxes. They're both available from our website. We encourage creativity when you're using the toolkit. So photographs, drawings, other ways of being able to collect this information can sometimes bring it to life a little bit more. And so each foundation goes through some key questions. So there are typically 3 in each one. So Silvana will just scroll through the 3 that we have for feeling safe. So we had who's important in your life, an opportunity for people to think about their support at home, and then the final question in feeling safe, which is feeling safe at home. So a conversation with the person about the things that help them to feel safe. Again, have a look at our how-to guide, because we talk a lot about the things that underpin safety for somebody, and that will look different for everyone. But what was really crucial is that our participants told us that safety and kind of trusting people can be really damaged in people's lives when they've had difficult experiences and when they've had hospital experience. And so actually, that's the thing that you have to work on rebuilding with people. And to do that, that might look different for each person. But as an example, somebody I support moved into a new home and there was no landline. And for her, over the years of her life, a landline has been a bit of a safety anchor, because she knew if something was wrong or if anyone was going to do anything to her that she didn't want them to do, she could pick up that phone and ring for help. And not having it was so crucial, and not having a mobile phone to get direct access to people to help her. And so these are the kinds of things that safety might mean for people. So these conversations are really, really important about really getting to know and understand, does somebody need to know where their team are at all times, even if you're sitting in an office needing to catch up on notes? If they're not supported at all hours, how do they reach out when they need help? What happens if there's loud noises in the building, other people living there? What's the impact on somebody's sense of safety? So these things will look different for everybody, but the how-to guide gives a bit more help with thinking about those things. So moving on, once you've done the key questions in each foundation, there's an opportunity to rate the strength of the foundation. So again, this is quite brief. We have 3 or 4 key questions for each foundation. The person rates whether they're red, amber, and green. And there are words to go along with that, depending on the question. And then there's a little table underneath each one. You can talk about what's working well and what needs to change. And it's really important that those boxes get filled in, because they will feed in to an action plan. The what needs to change is the how do I strengthen my foundations, basically. So you rate them, and then you move through to the action plan. So one is just going to move us on. Yep. So there's one more rating question and then the action plan. So the what needs to change box on here correlates with the one that you've just seen, where people complete that for each question. So you transfer your what needs to change over, and then it's got a what can I do and what can others do. And the reason we've done it that way is that in the research, people told us that they built their foundations alongside their support network. So they were really active in the process of building their own foundations. And that's really crucial, that people are involved, that they're a part of the process, and that they're the ones kind of leading it in a lot of ways. And so we have provided some boxes for each foundation that gives you some ideas about ways the person can be involved and things that other people can do to help. Once you've got your action plans, that's something for you to hold as a network with the support team, and to really think about, how do we set some timeframes around completing these actions, and how do we take them forward? You'll get a list of actions for each foundation. For some, one foundation might be working brilliantly. For other people, there might be things identified in each area. And there's an opportunity for you as a network to think about, how do we prioritise things to try and strengthen each of the areas. Okay, so that's the action planning section. So as I said, the same format is used for foundations 2, 3, and 4. And then the final section, which is living my best life, gives an opportunity for people to really think about long-term hopes and dreams, and to really think about how they see their life, what they would hope for the future. This section, again, the how-to guide gives some more information about this, but people told us in the research it was really important to have hope for the future, that when you've been through some really difficult experiences, it can be crucial to kind of be able to imagine yourself in the future living the life that you've hoped for. And actually, people told us some beautiful ways of being able to do this, where it has given them that hope, but also having hopes and dreams that are short-term and long-term meant they could realise some of those hopes. And when they did, that kind of helped them to know that people around them were wanting that for them and were going to help them to get those things in their life. So the Living My Best Life section is a really nice opportunity to kind of think about, what should my future look like, and what are my long-term hopes and dreams, and imagining yourself in a better place than people often were when they first left hospital. So that's the toolkit. That's kind of a quick glimpse. It is available for you to get a copy now off the website, and to be able to have a look at the rest of it. And from our point of view as a team, within that, there is within the toolkit itself, there is a feedback form. So if you do use it, please share with us kind of any feedback you have. We've started using it, and we are continuing to work on it so that we can kind of continue to develop it and add more resources. So yeah, Savannah, I think I'm handing over to you for the next couple of slides. Am I doing this slide, or are you doing it, Savannah?
Sorry, Louisa, technical issues.
Okay. I thought you might have. I was like, oh, not sure.
No, I'm fine. Yes, no, I am doing it. Thank you. Although I think you've perfectly teed me up. So, one of the things that we are doing is restructuring our website. So Louise has mentioned that the toolkit is on there, a feedback form is on there. We've got blogs that talk about kind of how we got there. Our animation video is linked on there. It is a work in progress. Louisa and her team have done an amazing job kind of updating it recently, but we're continuing to do so. We'll share the link for that. I think on the next slide or the slide after. We are at the moment piloting the use of the model and the toolkit in a local service, and we're kind of seeing how that goes when it's rolled out, and we're trying to understand kind of things that might need to change, what the impact might be of using the toolkit, kind of any benefits, any potential drawbacks. That's some work we've got ongoing at the moment. We'd love to do it in more areas. But that's something that is ongoing. We would also like to apply for research funding so we can kind of take this to the next level, really. So kind of roll out an intervention on the toolkit, consider different formats, different tweaks that the toolkit might need to be used with different people or in different settings. We're very aware that the one format that we've got at the moment might not be perfectly applicable to everyone. But as Louisa has said, we hope it is personalisable and flexible enough that people can use it to suit their own needs and their own circumstances. So this is our website. It's very easy to remember. Name, makingpositivemoves.org. There is a QR code if you want to and are able to scan that on your phone off your screen. But as I say, we will share all these slides. So our toolkit's on there. You can freely download that. You can complete the feedback form. You can look at all the other wonderful stuff. Oh, Pashtana's posted a link in the chat. Thank you so much, Pashtana. Sorry. So we are going to move on to questions now.